And is donor sperm the only solution for azoospermia? How common is this condition? What are the types of azoospermia?
Subscribe to our YouTube channel and press the bell icon so that you don't miss any important updates related to infertility.
Hi friends, today's topic of discussion is a very distressing and a disturbing situation for a male, that is azoospermia. What does that mean? What are the types of azoospermia? And is donor sperm the only solution for azoospermia? How can I, as a fertility expert, help you in such cases? Azoospermia is defined as the absence of sperm in the man's ejaculate. This can be found out by a microscopic examination of the man's semen after its liquefaction, called as the semen analysis, which is a part of initial panel of fertility tests of all infertile patients. So, in his initial semen analysis, if the man has azoospermia, can we label him as azoospermia right away? A big no. Temporary cause of azoospermia like shorter or longer abstinence intervals, spillage of semen during collection, time between the semen production and analysis, a few health conditions of the male like fever, cold, cough, sleeplessness can also cause azoospermia. So, it is always wise to repeat this test under optimal conditions before disclosing it right away to the man. There is also a terminology called as aspermia, where the man is not able to produce the semen sample at all. So, azoospermia is when the semen sample is produced but does not contain sperms, whereas aspermia is when the semen sample is itself not produced. These two are very different. So, how common is this condition? That is, how common is azoospermia in the world? 1 among 100 men all over the world and 10 among 100 infertile men are azoospermic. What are the types of azoospermia? Now, I'll give you an example of a tube light, okay, just for understanding's sake. Even after turning on its switch, if it does not glow, what all may be the reasons? First of all, there may be some voltage issue, that is, the current supplied to this tube may not be supplied properly, so that may be the cause that the tube is not glowing. Second thing, the tube itself may be at fault, that is, some gases inside or some metals inside may not be working properly. The third thing, there may be some dust coated over the tube light which might not be allowing light to pass through and reach your eyes. Similarly, in the case of azoospermia, if the sperms are not seen in the ejaculate, it may be because of these three reasons. That is, first one, pre-testicular. That is, the hormones from the brain may not be reaching the testis, that is the site of sperm production, in adequate quantity. How can I help them? That is, by supplementing the hormones which are supposed to be given to the testis. That is, in the same way as I supplement the voltage or current to this tube. Second cause of azoospermia is testicular. That is, the tube is itself at fault. The gas inside or the metals inside are not functioning properly. That is, though the hormones are reaching the testis properly, the testis are not able to produce sperms properly. This is the most difficult to treat. So, it may be because of the genetic abnormalities in the male or maybe due to the testicular agenesis. Some people may be helped by surgical sperm retrieval techniques like PISA or TISA. I'll show you the picture. PISA is percutaneous epididymal sperm aspiration and TISA is testicular sperm aspiration or extraction. Okay. In these cases, to prognosticate the testicular azoospermia case, a male physical examination and also a scrotal scan are very important. Post-testicular is the third variety. That is, these cases may have some obstruction in the passage of sperms from the testis to the penis. Okay. Causes may be various like varicocele, absence of the vas deferens, or even a simple vasectomy, that is male sterilization, and so on. This is the easiest to not just to treat but also to detect. That is, a fructose test is done in the semen analysis. The fructose positive patients are labeled as non-obstructive azoospermia, testicular and pre-testicular. Okay, whereas fructose negative patients are labeled as cases of obstructive azoospermia. So all cases of obstructive azoospermia are negative for fructose. How do you treat them? Just remove the dust layered over the tubulite. That is, by removing the obstructing factor, you will be successful in cases of post-testicular causes of azoospermia. Like, you can do a varicocelectomy or even a surgical retrieval of sperm, like percutaneous epididymal sperm aspiration or testicular sperm aspiration or extraction. This will help the patient and has a very good prognosis. Of course, milder cases of similar abnormalities can also be cured with antioxidants, vitamin D, and also certain antibiotics. So, please bear in mind that not all cases of azoospermia shall be needing donor semen. There are many patients who may be treated in various other methods also, through which we can give them their own biological child. So, a thorough evaluation of all cases of azoospermia is a must.
For more information, visit our website www.indiraivf.com or call 1-800-309-4410. Keep following us and leave your fertility-related questions in the comments below and get answers from Indira IVF doctors.